Okay, it's 11 a.m. and so we are going to go ahead and get started. Welcome to the 5th Annual Parent Network Conference. We're pleased to have you join us for this session. It is One Boat in Two Oceans, How to Create Collaboration Between Systems of Care. Before we get started, there are just a few housekeeping items. First, if you have questions during the session, there is a Q&A feature that is part of Zoom, and you can go ahead and put questions in there and we will see them. We may have some polls that pop up during the presentation, so feel free to participate. They are anonymous. After the session, you are going to see a survey about this session, and please take a moment and fill it out. If you are an Idaho parent who has a child with mental health concerns, the new Parent Network survey went live today. So you will be receiving an email with that link, or you can go to idahoparentnetwork.org to take that survey. We're excited. This year's survey is about the topics we address in our workshop. So we'd love to have your feedback. And in the coming days, we will be posting this recording, and along with the slides and our resources to help you. Once again, that will be on idahoparentnetwork.org. So with that out of the way, please join us for One Boat in Two Oceans. We are proud to have, let's see who's joining us today. We have Kimberly Berger, who is a behavioral specialist. She is DD Crisis, Prevention and Court Services, and she's with the Department of Health and Welfare. We also have Tricia Ellinger, is a parent extraordinaire, and she is the co-director of the Idaho Parent Network for Children's Mental Health. We also have Gina Judd joining us. She is a YES program specialist and clinician. YES is Youth Empowerment Services. And it's the Children's Mental Health Program here in Idaho. She is Division of Behavioral Health, Region 6, also from the Department of Health and Welfare. We are excited to have them here. And what you'll be learning today is you'll be identifying why being in two systems can be complicated. We'll go over the goals of the Department of Health and Welfare and developmental disabilities and mental health programs so that you kind of see where they lay. Understand what happens when systems make plans without everyone at the table. Explore what it means when when systems work together. And review some do's and don'ts of system collaboration and identify resources to help families. So we're excited. Ladies, go ahead, and I'm going to get the poll started and you guys can take it away.
All right, cool. We have a poll this morning. So I'm going to get started by talking a little bit about I have 3 children who are adopted siblings. They're full siblings, and they all 3 have co-occurring disorders. And so they have all kinds of letters attached to their name, diagnoses attached to their names. And that started for us, for me, when my son was 2.5. He's the oldest of the 3. And then it went on from there. So as he grew and developed and we got into programs and more assessments occurred, they added more labels. And then my middle and youngest child were identified as having some needs. And the alphabet soup just gets bigger pot of alphabet soup. And so if you're not familiar with these, seriously emotionally disturbed, that's kind of how I refer to my children. They do have ADHD. I do have a child with intellectual disability. I have a child with reactive attachment disorder, RAD. I have a child with auditory processing disorder. You just get all these labels. And so I think what happens is that for my kids, they're still who they are. They still are my 3 individual kids, and regardless of their label, I love them and I care for them and I want what's best for them. But the more you get into the system, the more assessments you have. It's a requirement of the system to have assessments. So in developmental disabilities, you have to have some labels. And then in the children's mental health world, to get access to certain services, you have to have some medical diagnoses and labels. And obviously, with school to receive services, you have to have some labels. So you could have a lot of alphabet soup there. And so my kids currently are 7, 8, and 9. So we've been doing this. I've been doing this since my 9-year-old was 2.5. And so it's been an adventure. So then later on, my daughter, who's now 8, we probably identified her at age 3. And then my autistic son, who's 7, I would pretty much say he wasn't really identified by the system until about 4 years ago. So it's evolved. And honestly, when they add another alphabet soup to one of my kids, I want to cry, just because it is not always helpful to give more alphabet. So that's kind of just a little background on me and that my experience with alphabet soup.
So hello, as Laura said, I'm Kim Berger. I'm the behavior analyst for the Crisis Prevention and Court Services DD team. When we focus on labels, I think it's important to know the reason why. The only reason to label a child is to receive the services necessary to improve their life. It's not to define your child's personality or their greatness or their uniqueness or to put them in a box. It's important to remember our goal is to receive the necessary services to improve that child's life. And when we look at this, not every part of every diagnosis is negative or something we need to change. When I look at this, I think about ADHD. Typically, children with ADHD sleep very little a night. I think Tracy can probably has experience with this, that children that sleep maybe 5-6 hours a night. This is exhausting for families, but it's not necessarily hurtful to the child. So let's focus on what's making the child's life hard. And do we need to focus on teaching the child how to be safe while other people sleep? Or do we need to focus on a sleep program, getting a child to sleep 8 hours a night? Different is not wrong. Your child being unique is not wrong. And these labels are not wrong. What we want to focus on in the DD world, and I think in the children's mental health world, is the behaviors that are making your child's life not as great as it needs to be. If that's elopement, let's focus on elopement. If that's being manipulative, let's focus on being manipulative and not just say, well, my child has TBI. The problem with that label is that often ends the discussion. People think they know everything about your child now because they know that label, or they've met one child with that label. So as we go forward with collaborative care, let's focus less on labels and more on behaviors. And I think we'll have a better outcome.
So as I said, I have these 3 children, and originally, this is really, 7 years ago is really before YES really rolled out in the youth empowerment system, really rolled out in the way that it is now. And so we started in the mental health world with my 2.5-year-old and were flooded with a lot of services, which then opened the door for, hey, there's this piece, this component we're missing. You should really, his diagnosis or his IQ test is showing us that there might be some other things going on here. He obviously had some speech and language, receptive and expressive language delays, fine and gross motor delays. And so then we got kind of, and I knew those things. It was more at the time at 2.5, he was nonverbal, screeching, eating out of garbage cans, and was pretty violent any waking hours. So he came from a family from trauma, homelessness, domestic violence. And so, if I was 2.5, I'd probably be doing the same things. So we first had kind of identified we need to work on some mental health issues. And then it was really need to get this DD, developmental disabilities component, looked at, evaluated. And I said, great, let's, he's a whole package. I just want what's best for my son. And so, and when that happened, fortunately, when we lived in the Magic Valley area, I could get my mental health people to work with things like occupational therapy and speech therapy. But that DD component was just over here, just outside of the grasp of them, of my mental health team. And as I navigated that, and those services were offered and those budgets were determined, I really felt like we're this boat, and I'm supposed to be in the Atlantic Ocean, and I'm supposed to be in the Pacific Ocean. And this is before he even went to school. So I call Public Education Canada because they're neutral. And so it was like, how do I maneuver this? And then once he started school, you have preschool. And we just weren't really collaborating. And then when you add my next child and my next child, and so my daughter is not, does not have a traditional DD label. She has developmental delays. And so with the developmental disabilities Medicaid enhancement, she was able to get some of those services, but she had primarily been in the YES system of care. And so you have these team members, and they're like, well, this is most important. Well, this is most important. Well, we can't do this until we're here. And as a parent, you just want what's best, hoping that your child can be functional to the best of their ability and not compare them to anyone else but themselves. And so it was a real struggle to what takes precedent. Are we going to do the mental health piece standalone? Are we going to do the DD thing standalone? Because how, as a parent, do I do all of it all the time and have good collaborators, speaking the same language, understanding the child, and having the vision or the hope that I have for my kids? And so it really, you really are going in two different directions oftentimes. And that was my experience up until probably a year or so ago. It was really my experience with all three of my kids is that we were going in two different oceans, and oftentimes having to take hikes to Canada to deal with the education piece. And so, when your team is not collaborating or you're not all on the same page, you're going to have some significant, you're going to be torn. And I live in a small community, and we only have so many resources. So that means we have to travel to get to services. And I had two kids that could go to daycare, one that couldn't go to daycare, one that did better in a home daycare, and one did better in a big daycare. And you need to do these assessments, and you need to do these plans, and you need to get this treatment. Honestly, I'm a single parent, and my hair, pulling it out and saying, I don't know how to do this, and I can't do it alone. And so that's kind of how we got to this point of having this conversation with the rest of parents and providers is, how can we make this less difficult and painful? And I don't want a parent should never have to choose. We're only going to focus on DD, or we're only going to focus on mental health, especially when you have a co-occurring kid. Or we're going to leave schools going to do their own thing. Never a good solution to have just everyone doing their own thing.
Tricia, that sounds like it's been just a huge burden for you, and I know for many other parents who are trying to navigate these oceans. And I really love the title of this workshop, because I think we all, to some extent, feel like we're in our own oceans or our own countries, and we're trying to work together. And I hadn't thought about it before the invitation to be part of this workshop, but I feel like children's mental health is like I'm a clinician in one in two oceans between DD and the parent. And I think that DD probably feels the same way. We're all very, very different systems. And so collaboration is critical. And sometimes there are choices that have to be made, but those should always, in my opinion, be made by the parent. Here's what we think is best. And so I want to kind of just identify or clarify, and Kimberly, feel free to jump in. The way that health and welfare is sort of like the globe for Idaho. Like it covers everything, or so much of it at least, giant system. And within that system are totally different states, like the Division of Family and Community Services, which is the umbrella for DD services, and the Division of Behavioral Health, which is the umbrella for mental health services. And so those two systems are like Delaware and Florida trying to work together. We know of each other, we collaborate if we can be brought together, but the speeding tickets and the legal system and like the whole system are really different. So it's a challenge for all of us to learn about each other and to work together. But the main thing is we all have the main goal of helping children. Parents get involved in the system not because they thought, oh, good, it'll be great to have a lot of bureaucracy in our life, but because they're looking for help. And that's the same reason I believe that clinicians and DD servicers get together. And I mean that why we choose this job. And so it's really just important to recognize that we're very different systems, and there's a little bit of friction when we work together, but we're all really in it to work together. And when we do, that's when things can happen to take some of the burdens off families, which is what we want.
Yeah, I agree with Gina that our ultimate goal is really the best interest of your child and your family. And although sometimes we do go about it different ways, when we collaborate well, the child makes great progress and the families see a huge decrease in stress.
Absolutely. I would agree with all of those things. And I love, Gina, how you said, Delaware and Florida, because that's really the truth. And the laws and the rules are similar, but not exactly the same. Funding sources are not the same. They're similar, but different. And so what is, in our family with my kids, you have this tug of war kind of thing going on, or that I would say, I truly, truly as a parent believe that the developmental disability system and the children's mental health system and family and children's services, Department of Behavioral Health really want what's best for my kids. They want to see growth. They want to see stabilization. They want to see improvements if they can be made. They want to support parents. But as a parent, when you're like, I can't do this all, and I can't do it alone, that when you step back, that you are sometimes like you're left out of the planning.
It sounds like Trisha may be having some technical difficulties here.
All right, I'm back. I don't know. My internet was a little bit funny, but there was one point in my particular family situation that I felt like I had to. I was to the point where I'm going to have to abandon my child to protect the other two. And their kids are too young for juvenile corrections, but I know there's lots of parents with juvenile corrections involvement. Things can go very wrong. And especially if all the systems aren't communicating, you can have people making reports to child protection saying this parent's not doing enough, doing too much. We really probably 14, 15 months ago, if things could go wrong, it couldn't go any worse than it was 14 months ago for us. So what happens when you feel supported or you feel like your oceans and states are all communicating is that you feel like, Mom, you're doing a great job. Dad, you're doing a great job. You can have open communication. I like to be CC'd in on emails just so I'm not left out of the loop. I think that cross-training needs to occur and happens when you have lots of kids. What I think happened for us was that we had a reactive treatment that was occurring instead of proactive. It was a breakdown in the communications between the two systems. They were vying for what they thought was most important. when all I wanted was a kid that was stable and functional and learning. So I think that when it goes right, you feel like, it doesn't feel like Christmas unicorns. It never feels quite like that, like rainbows and unicorns, but it feels, your blood pressure goes down. You feel like, okay, my team is working together and they're advocating for me. So go ahead, Kim. And I think we have a next slide.
Right. Thank you. So how do we give the families this ability to be supported, and how do we provide the best possible treatment for our child? And first off, I just want to acknowledge how difficult it is for families to do this, to try to coordinate with IEP meetings and children's mental health meetings and DD meetings and case managers and direct care workers. The moment your child gets into this alphabet soup world, your world expands to many people telling you how to parent and what's best for your child and what they think. That's got to be extremely difficult, knowing that you're your child's parent and you know what's best. When treatment plans aren't coordinated, one is bound to fail. It's human nature that we will do the least amount of work for the greatest reward. So if, for example, we have a child who, and I know our problems are all more severe than this, won't make his bed, and DD says, I just need you to not leave your pillow on the floor, and children's mental health says, I need you to make your bed, and they get the same reward, obviously they're going to love and work with the person who's going to require the least. This is going to sabotage our treatment plans all around. The only way to fix this and the only way to make this better is for everybody to be aware of what everybody else is doing, right? That we have a coordinated treatment plan focused on the child, that everybody has read and is in contact with everybody else on what they're doing. So we're going to talk about some tips and how we can actually make that a reality. I think that's Gina.
I forgot that I was muted, so sorry.
No worries.
And what you're talking about, the child and family team is the most critical part, getting everybody in the same boat. I really like what you said, Tricia, about CCing, making a habit of CCing everybody on the team. So for those of you who don't know about, you probably all mostly know about YES, but once a child has YES or is a member of YES, there are multiple ways to have a team. The bare minimum is to have a child and family team that meets annually in order to do treatment planning and to create a plan. And this is kind of like a 30,000-foot bird's eye view of, okay, we need some DD and we're going to need some children's mental health and then we're going to need some occupational therapy maybe. Gosh, it'd be great if kiddo got a job, whatever. It can be professional and non-professional things, but from the parent's view, you describe the vision to the coordinator, and then the coordinator and you can work together about who do we think we need to bring in on the team to create the sub-treatment plans is what I kind of call them, because DD has a treatment plan that they have to build, and a provider, not children's mental health, but the community provider, so Joe at Joe's Counseling, he has a treatment plan that's much more granular. That's down into, do we put the pillow on the bed? Do we make the bed? But this is kind of an overall map for the child and family as they're choosing the services. And that's part of what enables Medicaid to cover the services. Oh, we think we need CBRS. Well, let's make sure that's on what the child and family team builds, which is called a person-centered service plan, because that identifies the different pieces, brings in the different professionals, and they should be on the team once you've identified you need them. That's the way to begin. So sharing your vision, bringing the team together, and then lots and lots of listening and creative thinking. There's another component or process in the system called wraparound, which is like the child and family team on steroids because they meet monthly. But a child and family team, even if you're not a part of YES, can meet as often as the parent wants. And sometimes that's effective in helping to decrease some of that going to so many meetings. If you can bring everybody to the table once as frequently as you need to, rather than having to go to everybody else's tables, that's one way to have better conversations and I hope take more stress away from the families as they're driving the boat, because really their vision about what they want is what should be the deciding factor. And so we're here to push the oars and the parents there to drive the boat.
So speaking about the wraparound is like child team on steroids. Because I have 3 kids that are in the system and we have similar share providers, we at this time do have like monthly check-ins. Sometimes those can happen just through some email, but we've had to meet, and that's just directed from me. We need to all check in and make sure we're on the same page. And the only thing I like about COVID is we're able to meet via, WebEx or whatever is necessary. And so I don't have to drive anywhere. They don't have to drive anywhere. We can meet and be done, and there's no downtime. So definitely build your team and get everyone on that team, even if they're just participating through emails. Because everyone kind of needs to know what everyone else is doing to make it super effective.
The other thing that makes plans either succeed or fail is honestly how honest people are when you start your treatment plan. I understand that by the time people come to me on the crisis team, things are not fabulous. But if I go in the first day and I'm told, oh, well, Johnny is disrespectful to his sister, and I find out 90 days later, Johnny's actually been threatening his sister's life, and we need to look for higher levels of care and other placements and things like that. That's time that we've wasted. And it is so important to have a team that you can trust. It's so important to have a team that you can be honest with, because we can't fix problems that we're unwilling to acknowledge. And if you're not comfortable acknowledging problems to your team, then we need to work at maybe swapping out some members of those teams. When we come in and ask what the problems are, describe your child's worst day. Let us know exactly what's going on so we can be of help. We're not here to judge at all. We're just here to make life better. I have never once walked out of a meeting and thought, oh, what a rotten kid. It's never happened. I've always walked out and thought, okay, this is the to-do list. This is how we need to help. So really let us get to know your family. Let us get to know your team and what's important to you. If Sunday football is important to your family and you have a child that sounds sensitive, that just can't do it, let us know that, hey, this particular disability is affecting us in this way. So we can all come together and work on it. Don't suffer in silence with your child. Let us know what's going on with your family and give us the opportunity to build trust with you. That being said, if we do something that hurts that trust, if we screw up in a way that wasn't good, make sure you tell us, hey, you screwed up. We're tough and we can take it. And our focus is your child. Your child already has a developmental delay. That means they're already playing catch up. They don't have time for me to mess up. And they don't have time for you to be polite to me. Tell me what you need so I can get it done. If there are team members that you just feel judged by, or that you feel like your child is able to manipulate, or that it's just not working, it's okay to request somebody else.
Right.
It's okay to build the team you want. And trust me, they're going to be fine. Focus on your child. And focus on your natural supports. If you have amazing grandparents that want to jump in, let them. If you have amazing friends or school teachers that could offer insight to what's going on, make sure we include everybody who's positive in your child's life into this plan. Everybody who loves your child has something to offer, and let's use them all.
True. So just to lead off of that, I think that what I like that you said, describe your child's worst day, which I think as a parent, you have to be willing to be vulnerable. Mm-hmm. And so you have to be able to say, they're not judging me. They want what's best. This is not about me as a parent. One of the things I often tell people is, I'm not the person with autism. I just want you to know that it's not a parental deficit here. I'm not the person with autism. And so, but I have to be willing to be vulnerable and say, I have a medical condition. I have limitations. I'm not perfect. And so in describing my worst days, I also want to describe the really super great days when things go right. Mm-hmm. And I also want to describe to my team, there are some alphabet soup that are pretty scary. An IQ of 63, a child with reactive attachment disorder, they can be pretty scary. I have an incredible hope that my kids at whatever level will become functional adults. And so that's my hope. I can't predict the future. I don't think anyone can. And so as a parent, I have to be vulnerable and I have to be honest and I can't sugarcoat things. And I have said to companies, you're fired. I do a lot less of that now because I'm learning those skills to come back, and it's not really forgiveness. It's just working together and saying, this didn't work for me and I'm disappointed. And so firing people doesn't really work, but if you need a new team member, it's still okay to do that. When we've had lots of things that haven't worked, that we've collected data on, and yet the program says, well, this should be working. This is what we have to offer. I'm a data person too, and so I need to see some data that says this is what we want to, this is our goal, we want to see this happen, and this is how we plan to get there, and when are we going to check in to make sure we're heading in the right direction. As a parent, I am constantly adjusting, but your team is also adjusting. So whether we adjust the goals or we adjust providers, you're always kind of just in a place of adjustment, especially if you have multiple children. Even if you have, I have 2 adult neurotypical kids, and they're part of my natural supports, but there's a time when they say, I'm done, I'm not doing this anymore. And so I have to lean on some of my other natural supports, some friends of mine who say, I can't take all 3, but I can take 1. And instead of me saying, well, it's no good to just have 1 kid gone, I'm like, yes, just take the 1. And I'm going to do ice cream cones with the other 2. And so I think that for me as a parent, we, and I've heard it from others, that we kind of, in our natural support world, we burn bridges, or they don't understand, or they think it's a parent problem. Really, not everyone, it's not a one-stop shop. You can't go to the convenience store and say, I want one of everything. You can't expect those things from natural supports either. I have a friend who was only willing to take my daughter. I love her for that. I have someone else who says, I can take the boys, but I don't feel comfortable with your daughter. And so make a list of those things, of those people, and then think about what their help is going to be. So I've had people say, I could bring you some pizza. Well, when I'm mad, I want to say, take your pizza and stuff it. Now I'm like, pizza's great because then I don't have to do that. I can fix the broken window. I can call the repair guy. So great on the pizza. So don't throw the baby out with the bathwater. So when someone offers you something, don't sit there and say, they need to offer me more, or they need to offer me what I really want. I've gotten good at saying, yeah, that would be super nice. Because people want to help, and they want to be part of your family and support you. And so, yeah, you have to just kind of work together.
Yes.
So here we go on to some things to avoid. Don't assume incompetence. I know that my developmental disability workers are very gifted in their field, And I know that my children's mental health people are very gifted in their field, but I've gone into this thinking, you don't know anything about this alphabet soup. So I've had to learn that people do know a lot of things, and they're willing to get trained, and they're willing to train to learn about your kids. I've had to learn, and this has probably been in the last 15 months, really, the Department of Health and Welfare does care. So they used to be a curse word at my house, and now I'd say they are part of my partnership. And so I have to believe that they want what's best for all of us, and that they're not making choices to make our life difficult. There are lots of fears. I have lots of fears about the future with my kids. I have fears about things not working. And so your team, I have my DD case manager who's super great. I can call her or text her and say, and she's super supportive. And I have other people in the Idaho Parent Network that I email and say, I just want to vent. And so find your people that can support you, because you don't have to live in fear. My biggest thing is don't get stuck in mad. Because I've been there, I fired everyone. And that's huge when you live in a teeny tiny town. And so don't get stuck in mad, because you can move past it. You can, I love that Kim and Gina have said, you're not going to hurt our feelings. We're not going to hurt our feelings. You just got to tell us what's not working. And so I found that to be much more effective than just writing someone off or a company off and saying, let's figure out what went wrong here and try to problem solve how to fix it.
Well, and I think when we do talk about don't stop reaching out, burnout is a very real thing. It takes 4 years to become a special ed teacher to get your bachelor's degree. The average person in a special ed field burns out in about 18 months. It takes longer to get the degree than people last in this field. So when people do burn out, today I'm talking to parents. You guys don't actually have the option at 18 months to say, okay, yeah, I'm done with this now. Let's do something else, right? So really be compassionate, like Tricia was saying. Those people in your life that all they can do is a pizza, the grandma that can only handle maybe dessert once a month, accept gifts for what they are, accept that people are doing the best they can with what they can. And find new supports and new resources, understanding that things might have to be adapted to work for your child and for you. And if you have the opportunity to attend places where you get support, I often tell people, if you can go to book club, go to book club or girls' night or whatever you do. Even though you're thinking, I'm exhausted, I'm tired, really build those natural supports in your life for you. You'll be better off, you'll be well rested, and you'll find places to get what you need, even if it's a million tiny acts instead of one person. So look for new ways that we can get things done. What's going to work for others isn't necessarily going to work for you, but as we work together as a team, we'll find a way to make it happen. But like I said, continue to find relationships of your own and support them.
Yeah, and so when you do get off track, when you do feel like firing everybody in your life because they don't hear or the plan's nothing's changing, all of those things, there are some things you can do, because no one wants to be out of the boat. You're going to drown out there. You need to stay in the boat and keep your helpers in the boat. One thing I like to think about is there are all these plans, right? Well, people don't fail, plans fail. And so if something's not working, let's look back at the plan and see where that is instead of the person. And maybe the plan failed because somebody didn't do their job, or they then we talk as a team about, well, what are the barriers you're encountering so that you can remove those barriers so that the plan can move forward. And but at the same time, it's really painful and really hurtful if you're feeling like you're being torn by all the plans. So like we've been talking, just acknowledge that people are trying to help and they're imperfect. And I think a big part of making a good plan is being honest about the imperfections and really good with boundaries. No, I can't do that, but I can do this. And if every team member feels empowered to be really honest about what they can and can't do, then the plan is going to be better. Now, sometimes we feel let down when somebody who we really hoped would do something says, no, they can't do that. And then we have to manage those feelings, either on our own or maybe one-on-one with that person, so that the boat can keep on moving. And that's part of that, being willing to help team members feel heard, is being willing to listen, being willing to not take it personally, and be able to say, hey, yeah, I fell short here. Gosh, I really didn't understand how different DD is than children's mental health. What? You have a whole different plan and mental health is just a little part tacked on the bottom? Let me understand that more so that we can have a better view. And that will never happen if we get our feelings hurt and our defenses up. It just distorts the signal so we can't hear one another. And then we have to be willing to try again. Isn't it a great thing about life that we're not the same people we were 2 years ago or 1 year ago? We can grow and we can learn and we can keep on trying. And if we lose that, then we really lose anything that will ever propel us towards that vision, like you said, Tricia, of your kids growing up and being independent adults, whatever that looks like for them. We have to be able to keep that openness to learning and to trying. And when bad things happen and you're just feeling wounded, sometimes it's an okay thing to just take a minute and seek some support for those wounds, even with the team. And if your team doesn't feel safe to do that with, then that's some pretty hard conversations that need to happen, because your team needs to be a safe place. So feel free to swap it out. I often tell kids that counselors, and I think this goes for everybody on a team, we're a lot like shoes. You might be a size 7 and I might be a size 10. And even if I'm a really nice looking shoe and you really like me, if I'm size 10, you're size 7, we're just not going to fit. And that's okay. Yeah. I need to know if I'm giving you blisters, and I need to be able to handle that and either come up with the duct tape or tie the shoe tighter, or maybe offer you a different shoe. And that's part of letting go of what we can't change. So identifying your options. Okay, that plan didn't work. I love that you keep an inventory about, here's what we've already tried and here's what didn't work. Well, great, because we don't want to keep on making you wear a shoe that didn't fit. Maybe occupational therapy just did not work. And if that's what we keep on trying, you're just going to get feeling worse and worse. So I think the biggest things are being willing to talk about what doesn't work, being willing to acknowledge what you don't know and what you can't do, and keeping in mind that together with all of our brains, we can come up with a new plan or at least a new try. And if it doesn't work, that's great. What did we learn from that? Because every plan we make and implement, we either learn that it doesn't work or that it does work, or that, oh, there's this giant boulder in the way that if we move, maybe then it will work. So remembering a failure is actually kind of a gift. It might slow us down a little bit, but what did we learn from that so that we can steer around it next time? Those, I think, are the most important keys for helping us stay on track.
Well, and I think, some of the things to getting back on track is really going back to what our focus is. Going back to what are the behaviors that are causing the problems. And acknowledge that even if you have a team member that might be a wrong shoe size, they all want positive outcomes for your child. I've never met anybody that says, my goal is to sabotage this child and this family today. It just doesn't happen. But sometimes bad things happen. Sometimes treatment plans fail, and sometimes they fail badly. And we need to get back on track. But when we all start with acknowledging that we all want what's best for this child, we all want what's best for your family, then it's easier to move forward. And giving and accepting forgiveness. There are going to be bad days. And there are days where somebody might be, a parent might be a little short with a staff. And that's okay. And life goes on. And there might be a day where a child's just had all the therapy he can handle and he's done. And that's okay. It's okay to change things up in the middle and say, this is what this child can do today, even though he could do more yesterday. Let's give ourselves a break. Let's do the best we can every day and hope for the best. Sometimes we're going to mess up. And let me apologize in advance for that. We are going to do things that are not right. We will fix them as quickly as possible and move forward as quickly as possible. And it really does help us if you tell us, hey, this doesn't work for my child. You know, quit offering my child Spider-Man stickers. He hates them with a passion. If you'd let us know that up front, we can move forward easier, right? Emails, phone messages, Zoom. The good thing about the pandemic is it's never been easier to communicate with everybody. Everybody on the same page is how life gets better and how our treatment teams get better. So I just want to let the parents know that we are here for you. We're here to help. We're not perfect, but with communication, we do believe we can have a positive treatment plan for every child.
Gina, I just wanted, we touched on this just a little bit, but the wraparound services. So I think that when you have very complicated children with complicated situations or levels of care, that there is another system, another support that's available to parents, so you don't have to do all this navigating by yourself. And that's what the wraparound is with the capital W that's available to parents who just say, I can't do this. I don't have, I need help.
Yeah, wraparound is, like I said earlier, very, very similar to a child and family team, but it's a very concrete, in some ways, process. We work really hard at doing it to fidelity because there's a lot of research behind the way that there are many wraparound programs. And it's been a word in the system for decades. Idaho has just over the last 2.5 years or so begun utilizing a different type of wraparound, a different model is a better word for it. And it is meant for families and children who have high needs and who are balancing or waiting or whatever you want to call it between multiple systems. It's meant to bring a family, for a family to bring a team that they identify together, to bring the team that they identify together around the same table. It's very regimented in terms of there are 4 phases, and this is what we do in each phase. It usually lasts for about between 12 to 14 months. And it is nothing more than a planning process. So it brings that team together that you identify. We get to know the family, help orient the team. Here's what we're going to do. Everybody makes a commitment to work together as the team through the long haul. We have about 10 principles that we rely on to guide us when things get challenging and sticky. And some of those are family-driven, youth-guided. You guys are the bus drivers, or you're the engine, and we're all the rowers, the team members. We write up a specific plan based on the top needs that you identify. And I think that's one thing that's key about wraparound is we're not about bandaging behavior. we're about meeting the need that's underneath the behavior. So we're very needs driven. What are the needs? What's the heart of that child's misbehavior? Or what's the heart of the problem that's happening at school or socially? Oh, it's about communication, or, oh, it's about education. It's not. So we work on that. And then we brainstorm together. Okay, team, Mom and Julie said that they really, really want Julie to be able to get and keep a job. Okay, if that's need number one, we'll go for that. Then we will look at all of the strengths that Julie has, and that includes the supports in her life. It includes her talents and interests. It includes lots of different things. And we utilize those strengths to brainstorm a big list, like a menu. And then we say, okay, Julie and Mom, what do you think are going to be the best strategies for helping you get this job? Oh, well, we think Julie really needs to work on, we need a team member to identify all of the places that are hiring that work with animals, because she loves animals. And we need to help her get into those special classes at high school that are about veterinarian service. And so those become strategies. The families choose the strategies, and then the team jumps in to help carry out action steps to move those strategies forward. And that happens over and over and over until we either run out of time or until we meet the needs. That's what wraparound is.
And I think it's a great resource to those complicated families that need someone in for the long haul, that can do some more intensive brainstorming and problem solving and dig deeper. And I think it's a great thing that's a service that's available to families. I think we're going to wrap it up now. There doesn't seem to be any questions that we're aware of. So some of the resources, I mean, if you just go to these websites, you have to dial down a little bit, but if you're not familiar as a provider or as a parent, dig down. What's not listed on here is the Idaho Parent Network. Another really great resource is the Idaho Federation for Families. I'm telling you, they've saved me. They've connected me. They've rescued me. They've cried with me. So there's lots of things that are out there that can make that collaboration work better. And there's even things like with the Idaho Federation support groups, if you need someone that's going through the same experience as you. Some are virtual, some are in person. There's lots of things available.